If you see an ad or some kind of video where someone's guaranteeing or promise they can fix your back pain, that should raise a red flag. Hey, Dr. Chris Gubbels here from Square One Health, and today I want to talk to you about the 7 most common causes of back pain. Because here's the reality. Before someone can ever determine if they can help you with back pain, including our office, you first have to understand what is actually causing your back pain. You see, there's lots of potential different causes, and frequently there's more than one thing that can be contributing or leading to back pain. But once you understand what's causing someone's back pain or your back pain, then we can determine what the best and most effective treatments are going to be. So I'm going to overview the 7 most common, or what we have found to be the 7 most common causes of back pain. Number 1, having an anatomical short leg. Basically, having one leg that is shorter than the other. The reason this can cause back pain is because if one leg is shorter than the other, that's going to cause your pelvis to tilt. Your pelvis will be unlevel. If your pelvis is unlevel, that's going to put uneven stresses on your disc and your joints. That can cause to the openings for the nerve, where the nerves come out, to be closed off. That can lead to a disc bulge or a disc herniation. Lots of different problems. And some really high quality research shows that if we increase your leg length with a proper shoe lift and we level off your pelvis, that can be very effective at treating or decreasing back pain related to an anatomical short leg. Number 2, degenerative disc disease and or arthritis. Now, first of all, degenerative disc and arthritis are actually 2 different things. A degenerative disc has to do with the decrease in height of the disc, where arthritis has to do with increasing bone spurs or breaking down the bone material. When we have those both, the term is actually called spondylosis. But for this simple video, we're going to call it degeneration. Now, the reason having a disc degeneration can cause back pain is several factors. 1, when your discs degenerate, research shows you actually grow more nerve endings around the outside of the disc, specifically the nerve endings called nociceptors that are responsible for detecting pain. So naturally, if you have more nerves that can detect pain, it's easier or more likely for your body to send pain signals to your brain. So one of the reasons that can cause that is you have more nerve endings that can sense pain. 2, as your disc heights decrease, that's going to cause a narrowing of the opening called your neural foramen, where the nerves come out. If the opening where the nerves come out gets smaller, then you're more likely to irritate those nerves. And the other reason is, as your disc gets smaller, that transfers more weight to the back of the vertebrae and what's known as your facet joints. And they have to carry more weight, more pressure, which can lead to more pain. So degenerative disc is another common cause of back pain. Changes in the curve in your spine. Here's the deal. Just like you have normal ranges for blood pressure, normal ranges for heart rate, normal ranges for cholesterol, you have a normal alignment in your spine. From the front, you should be straight. From the side, you should have curves. Curve in the neck, your mid-back, and your low back. And if your curves are outside of normal limits for yourself, that's a problem, and that can lead to back pain. In fact, it frequently leads to back pain. Now, the other thing is everyone's anatomy is a little bit different. So how do we determine what is a normal curve for you? The good news is there's a ton of fairly high quality research explaining what normal curves are and how you measure that. There's a term called pelvic incidence. Basically, we can measure the size of your pelvis, and based on the size of your pelvis, we can determine how much curve your body should have. And if the amount of curve you should have does not match how much curve you actually have, that's a problem. You could have too much curve. Too much curve is actually more associated with acute or newer back pain. It puts more pressure on the back of the disc and it closes off the nerve openings. Having a loss of curve is a more common and generally a more chronic problem. And having a loss of curve in your low back from the side is probably the most common cause of dealing with chronic back pain. When you lose the curve, one of the things it does, it puts all the pressure on the disc. And that can actually cause the inside of your disc, like a jelly area, to push backwards and put pressure on the spinal cord or the nerves going down the spinal canal. So having a loss of curve is a huge problem. You have to properly evaluate your curve and if your curve falls to the normal limits. Now, another one, a common cause, is something known as a subluxation. A subluxation for this term is basically when a joint has lost its normal movement. You see, you have lots of different receptors on all your joints, your muscles, your ligaments, and your disc. And these receptors tell your brain where everything is in position and space. That's why you can take two fingers and touch them behind your head, even though you couldn't see what your fingers are doing. You have some of these receptors that send a positive signal to your brain that shuts down stress or pain signals when joints move. You have other receptors that send us stress signals called nociception. And if joints don't move or something is irritated or injured, this stress signal, nociception, can become pain. So when you get something called a subluxation, or your joints get locked up and don't move, that creates a bunch of stress signals that can become pain when it reaches the front of your brain. When you restore normal motion to these joints, it actually shuts down or dampens these pain signals, which is why naturally when you injure a joint or a part of your body, you shake it off, you move it, because that shuts down pain signals. Chiropractic adjustments can be very effective at getting subluxations to move properly and decrease pain and stress signals coming from those fixated, stuck, subluxated joints. Scoliosis. Scoliosis is basically when you have a lateral bending and twisting of your spine. And it is a really common cause of back pain in adults. When we look at adults, about 10% of people over the age of 40 have scoliosis. But if we look at people over the age of 60 years old, it's about 38% of the population, more than 1 out of 3. And once we hit 90 years old, it's over 50% of the population. When you have a scoliotic curve and you have a lateral bending and twisting, that puts uneven pressure and stresses on the joints. That can lead to disc bulge and disc herniations. That can lead to arthritis, and it can actually put pressure on those nerves. It's a real common cause of back pain, and there are specific treatments that you would do for someone that has back pain related to their scoliosis. Disc herniation and disc bulge. I'm going to clump these together, but they're actually two different things. A disc bulge, well, first of all, let me tell you what your disc is. Your disc is the connective tissue between two vertebrae. It's made up of an outside cartilage layer, and on the inside there's basically fluid called the nucleus pulposus. The disc is responsible for maintaining the space between your vertebrae and also keep the opening for the nerves that come out. When you get a disc bulge, it's basically like you're squishing that vertebrae, and the overall disc is basically sticking out from the outside. A disc herniation is when you have a more specific portion of the disc actually pushing or poking through. And a disc herniation is typically caused by an injury. A disc herniation, there's several different types. It can push out, so the disc material on the inside can even completely separate or extrude from the disc altogether. But how disc bulges and disc herniations cause pain is they tend to close off the opening for the nerves. They can narrow the opening going down your spinal canal, and they can also narrow the opening where the nerves exit the side and go to the rest of the body part. But there are specific treatments we would do for someone that has a disc herniation and disc bulge. And a lot of times if you have these are the people that are going to get radiating pain down the back of their legs. Bending to a side or bending forward tends to increase that pain depending on where the disc bulge or where the disc herniation is. And then number 7, being overweight. Obesity and being overweight is directly proportional or related to having back pain. And the more overweight you are, the more likely you are to have more back pain. So having an effective weight loss method or a weight loss program can be a critical role of reducing someone's back pain. Now, I said I was going to give you 7, but I'm going to give you one more, because this last one is something that we're seeing a lot in modern day society. And that is called having a positive anterior sagittal balance or positive forward lean. And this last one is when you see people where they're starting to lean forward. You see, your spine is designed to be in balance. And when we look at your spine from the side, the top of your neck, your lower neck and upper back, your mid back, and your lower back should all be in alignment if your spine is balanced. If you have that, it's going to be very strong and very stable. When you look at it from the side, when your body starts to lean forward and you start to hunch forward like this, that we see in a lot of people as they age, when you lean forward, that puts a lot of pressure on your lower back. And when you get more than 40 millimeters, that's a high predictor of having chronic back pain and disability. So that's when we're seeing a lot, and it's becoming a big problem. So these are actually, I said 7, but I gave you 8 of the most common causes of back pain. When someone comes into our clinic, the first thing we need to do is figure out what is actually causing their pain. Once we know what's causing their pain, then we can determine the best and most appropriate treatments. And then when we have the best, most appropriate treatments, we can get the best patient outcomes. So again, Dr. Chris Gubbels from Square One Health. I hope you found this information helpful. And remember, whenever you hear someone say, we can for sure fix your problem, we're experts at this, how do they even know until they first determine what's causing it? And the second thing you want to look at is, do they have specific treatments for specific problems and specific causes of problems, or are you going to a place where every single patient's doing the exact same thing? Look, if you go into a place and everyone's doing the exact same thing, some people are going to get better and some are not. That's just how it works. You need to find some place that does very specific treatment for very specific problems for very specific causes, because those clinics are going to get better results in a vast higher percentage of their patients. Dr. Chris, Square One Health. I hope you found this helpful. Like, share, comment below. And if you like this information, be sure to subscribe.